My name is Ryan Boyles. I'm the owner and editor of Health News Illinois. We have a wonderful panel joining us this morning to discuss AI in healthcare, just help us try to understand a little bit of what's happening in that field and just what's next. So I want to thank our esteemed speakers so much for sharing some of their valuable time with us this morning. I am thrilled to introduce Dr. John Handler, the Senior Fellow, Innovation, OSF Healthcare. Stepping in for Hector Rodriguez this morning is Dr. George Cybulski, the Chief of Neurosurgery and Clinical AI Leader at Humboldt Park Health. And we have Dr. Abel, the Director for the Institute of Director at the Institute for AI in Medicine at Northwestern University, Feinberg School of Medicine. Representative Bob Morgan is running just a little bit behind, but he promises he will be here hopefully in the next 15, 20 minutes or so. Before we get started, I want to make sure we thank generous sponsors of the Health News Illinois event series. These important discussions would not be possible without their support. So a huge thank you this morning to the Illinois Health and Hospital Association, the Illinois Primary Healthcare Association, Novo Nordisk, and Springfield Clinic. Health News Illinois is an online nonpartisan news service. In addition to hosting events like this, we also publish a daily email newsletter. If you're interested, you can sign up on our website for a free trial at healthnewsillinois.com or just talk to me after the event. I also just want to let everyone know that there are still opportunities to become a sponsor for these events in the 2026, both in person and virtual. If interested, don't hesitate to reach out to me after this and we can talk a little more about it. Without further ado, let's jump right into the discussion. And I was just talking to the panelists before we started that usually this person is in the hot seat to get us going. But since this is empty, we're going to skip over. We're going to go to Dr. Handler on this.
I tried to not be in the hot seat.
Yeah. So, just want to start with you. I just want to kind of set the stage for today's discussion. And just as we sit here today, December 3rd, 2025, just where do you see things now with AI in healthcare? Just kind of help us set the table for kind of where things are at this point.
Sure. And
hello?
There we go.
I mean, it's pretty intimate, but still, first of all, before we start, let me just say, and Abel's heard me say this before, everything I say is just my own opinion. It doesn't represent anybody else or my employer or anything. And I am going to agonize, even in this intimate group, about what I said. And did I say something incorrect, or did I express myself wrong? Trust nothing I say. Treat me like AI. Double check everything. Okay, there we go. With that in mind, I think it's an interesting time because I think people have become much more comfortable with AI. Many of us have now used AI in our personal lives. Many of us many of those who are practicing have used AI in their practice now with the ambient scribing, and people have become somewhat comfortable with many of the things that AI can do. People are also now much more personally aware of the ways that AI can both help us and can fail us utterly, and in ways that seem super shocking and embarrassing almost. And so I think we're getting to a place of some understanding and comfort of what AI can do and what the potential promise is. What I'm not sure, what I suspect, and I'm not sure people realize, is when we have things that are growing exponentially, which I think AI is doing, they tend to think linearly, and so then they extrapolate out, what will the future be like given what I'm seeing now? And they think linearly, but if it's actually going exponentially, then what happens is the future comes way faster than they expect. And so I think we may still, despite everything, be underestimating the impact that AI is going to have. And when I say AI, I mean the modern AI that we've seen and the new developments that will inevitably happen. So I think it's an interesting time. It's one in which we have increasing comfort, maybe too much comfort. Maybe we don't realize how much change is still to come.
Definitely. Dr. Cybulski, I want to go to you on that question. Just kind of, what are your thoughts on this? Kind of, how do you see things at this point in healthcare and or AI in healthcare? Just how have things just changed in the last few years?
I Thank you, Ryan, and thanks my friend Hector Rodriguez, my collaborator at Humboldt Park Health, where we're doing clinical decision support platform in the emergency department. So I'm a big fan of companies and reading about companies and success of companies. And one of my heroes is Andy Grove, the late co-founder of Intel. And he wrote a great book. It's called Only the Paranoid Survive. And we need not be paranoid, but we need to be alert, because I think we're at, as Andy described, we're at an inflection point in healthcare. And AI is the tool that is creating that inflection point, or is a tool for dealing with that inflection point. And we have in healthcare lots of challenges due to, as we've seen with the various federal programs. I'm not going to mention any by name, but we really have a challenge, and I think AI is going to be the tool that will help us at this inflection point.
Absolutely. Dr. Coe, I want to go with you, just kind of get your thoughts on this. Just where do you see things standing right now, and just how has it changed us in the last few years?
Yeah, I mean, I think like the rest of every other industry, people recognize that artificial intelligence is transformational. I'm with Jonathan on this. I think it's not linear; it's exponential. And I think that there's a little bit of a panic in the C-suite that how do we get on top of this? How do we sort of get more informed about it? How do we place bets on horses that are going to win? I think what's become clear is that because one of the biggest burdens in healthcare traditionally has been our time, that there are tools like ambient scribe that are just winning the game. They're absolutely going to take over the market. But along with that, I would say that there's the potential for really tremendous disruption that people aren't even thinking about today.
Mm-hmm.
So, for example, like electronic health records, they were installed and put in place over the course of 20 years in this country, and they were really disruptive, not in a good way, not in the innovative way that we thought they would be. They're just disruptive, to our workflows. Ambient scribes come along, and those have this potential, I think, to disrupt the whole electronic health record market.
Mm-hmm.
Now, I was just talking to somebody at Shirley Ryan yesterday, and they're using Cerner, which, if you look at the way the world has gone, Epic is like this, and Cerner is like this. But a couple of months ago, not many people saw this, but Cerner Oracle announced that they're going to go with an all AI EHR. And everyone thought, what are they talking about?
Mm-hmm.
But they've got it implemented now. So at Shirley Ryan, they're working on this. And it's just like any ambient scribe, it's saving a bunch of time. But what's interesting about building an electronic health record from the bottom up,
Mm-hmm.
with AI, like right from the inception,
Mm-hmm.
is that they can take full advantage of all the AI tools that might be able to be baked into the workflows. Whereas I think an incumbent is still tethered to a really old underlying database structure, MOPS, which is like 50 years old. And so you've got this potential now for that curve to invert. I think Cerner could sort of pop up, and that's just one example. I think there's a number of existing incumbent technologies today that don't even know it, but they're obsolete. And I think that's what we're likely to see is complete almost rip and replace. Not even it's just going to happen because there's technology that's light years better. It reminds me of the iPhone. When the first iPhone came out, it had no buttons on it. It had just one button. Well, imagine the EHR with no buttons. And I can not only imagine, I would love that. And I think that's a reality today. So.
Definitely. Now, Troy, I want to stay with you then a little bit, and I want to give each of our panelists, a little chance to kind of shine a light on some of the stuff their organizations are doing. But Dr. I wonder if you could just tell us a little bit about some of the initiatives that Northwestern and the Institute for AI and Medicine are doing in this field right now.
Yeah, I mean, one thing that we're really focused on is education, because the reality is that most people that are in leadership today have never really been exposed or had hands-on experience with it. And so I'm personally really focused on how do we create educational opportunities for who will be the future leaders. And the future leaders are oftentimes people who are much, much, much younger than we are. They're people coming in who have, through their high school careers, been using AI already. They're digitally native if they've been a couple years more advanced than that. And so, whether it's in the medical school curriculum, we've had a medical school curriculum that is incorporate data science AI for 5 years now. So we've been doing this, one of the first in the country to do that. We put together practical coursework that people can experience and use and interact with data sets and the latest tools. We're trying to greatly expand that. And then we're also trying to put together executive education, tailored towards physicians, for example, so that people who are in the practice of medicine can also not be obsolete. They can be the ones who use AI and are, I think, part of this revolution.
Definitely. Dr. Cybulski, I want to go to you on this. I've talked with you and some of your colleagues over at Humboldt Park Health, and it seems like AI is something that you're really jumping head first into. I wonder if you could just talk a little bit about some of the initiatives that Humboldt Park Health is doing, and just kind of also why the provider decided to go so head first right into this, this field.
Well, thank you. Yes. So basically, 5 years ago, maybe even more, I thought about how would I replace myself in terms of evaluating patients, and then I became more aware of artificial intelligence and the ability to impart into a digital twin, if you will, of myself, and that would be for anyone who is encountering a patient with a spinal condition. I focused on that. So I was at Northwestern for many years. These are my colleagues here, and good to see them again. And I retired, but then one of my former trainees at then Norwegian American Hospital called me up and said, "Are you really retired? Why don't you come and work with me again?" He was our spine fellow, and let's take care of patients who need spine care at community-based safety net hospital. I said, well, yeah, this would be then probably a place then to see if I could implement my interest in a AI platform for clinical decision support and low back pain. And our CEO, Jose Sanchez, and Hector Rodriguez are very supportive and experienced, and that allows us, to develop this and put it in place. And so we have a proof of concept going right now, which we would like to expand eventually into musculoskeletal clinical decision support. And I think it's great. My colleague from the emergency room at Northwestern here knows that he can't see every patient, that he has residents, and now we have PAs and MAs, and so I think this is a great opportunity to develop it, and it's being developed. I mean, there's a great review paper out there in British Medical Journal last year about degenerative spine conditions. So we're in a place where we're open to these opportunities.
Absolutely. Dr. Handler, I wonder if you could just tell us some of the steps that OSF is taking in this space.
Sure. I think, there's almost no part of our organization, I feel like, that isn't, putting their hand somewhere in the AI space, and especially the generative AI space. We have either implemented or are evaluating, first of all, almost anything that our electronic health record, has in this, which is a lot. We're seeing what makes sense to bring in first, and then trying that out, and we've had a lot of successes there. There's a lot of companies that are, knocking on the door, and we've opened the door to a bunch of them, and things that we're doing in imaging and imaging analysis, things that we're doing in colonoscopies and automatically helping the clinician to identify adenomas, which are potentially polyps that could be bad, or become bad. Things that we're doing to use AI to help facilitate our integrations with external vendors and our data integrations, which used to be a very hard manual process, and still is a very hard manual process, but can we make it easier? And so there's almost, another thing that we're doing, for example, is, you know, we get a lot of written comments from patients on the patient satisfaction surveys. And how do you go through those, right? You know, we used to have a human read through them. Now we're exploring to see, can we have an AI read through those things, highlight the ones that need to get surfaced most importantly, and give us, you know, aggregations and summaries of those things. I would say there's 3 areas in our internal development innovation labs that, you know, I might highlight. One is we have Dr. Adam Cross in our pediatric lab, and he's looking at AI to help identify patients, children with rare diseases, very rare diseases, and also AI to help identify and make diagnoses of patients with concussion, so neurosurgical sorts of things. We have Dr. Matt Bramlett, who's a pediatric cardiologist, and he's looking at AI to automatically identify in what we call segment, meaning figure out what part is what on CAT scans and MRIs in order to help on 3D reconstructions to identify, let's say, patients with aortic aneurysms and things and how big it is. And on my own side, I'm very excited about the potential for AI to help us assess the quality of every interaction that we have with patients. I think for the most part, I'm not speaking for OSF, I am now giving my opinion about my experience with healthcare in general, is that especially in the outpatient space, but also in the inpatient space, in general, we assume that if you saw a credentialed provider, then everything was perfect, unless you tell us otherwise. Even though we have plenty of data and studies out there to say that that is not a fact. That is not true. In fact, that's why I'm sure one of the things your company was aiming to tackle here. So, so I think step 1 is, well, to measure something, maybe to manage something, maybe we have to start measuring it. And I think now the new technologies give us a chance to potentially measure quality, and that's for me step 1.
Absolutely. And now, Dr. Handler, you and Dr. Koh, we had a similar panel a few years ago on this topic, and at the time we talked about AI as this great unknown and, you know, all the potential for it. Here in 2025, I think it was about 2.5 years later, what more do we know? Like, do we know yet whether or not it's going to live up to the height of the potential? Dr. Handler, I'll give you that easy one.
I think it will. I'm going to make a prediction. Predictions are dangerous. It will definitely live up to the hype. It'll exceed the hype. I think the question is, under what time frame will that occur? I mean, if you say in 100 years will it exceed the hype, I would bet a lot of money that answer is yes. If you say in 2 years will it exceed the hype, probably not. And so then when exactly will it land? And what I think will happen is, just as it has with everything else, it'll seem like nothing's changing, and then you'll turn around and look back and go, oh my gosh, look at how the world has changed. And that's what I think is going to happen here. It's going to be a bunch of things that they're shocking when they happen, and then we just kind of accept them. And so I think we have a lot of exciting things that I imagine are coming on the forefront. I think what we're going to see in imaging is going to be very impressive. I think the way that I hope that what we see in terms of clinical decision support is going to hopefully dramatically improve how we handle, optimizing the quality of care that we can provide every single time. I hope that some of this stuff that helps take away some of the manual work makes it easier for patients to get through the process of healthcare, both getting the healthcare and the payment of the healthcare and all the other stuff. So I think the hype will be met and exceeded. I think it'll happen longer than we wish it would, and shorter than maybe some people think it will. And so maybe that's kind of a wimpy answer, but that's what I have.
I like it. Dr. Koh, again, you were on that same panel as we talked about that a little over 2 years ago. Where do you see things down here in 2025?
Yeah, I'm with Jonathan on this. I think it is actually going to live up to the hype. I mean, 2.5 years ago, we didn't have AI scribes. 2 years ago, we started using AI scribes, and now it's standard of care. So in a 2-year cycle, that has already happened. I'm also incredibly bullish about the ability for machines to understand patterns that people can't with the far more nuanced data it's capturing today. You know, I gave a guest lecture yesterday, I was in campus to a bunch of mechanical engineers. So my background was actually in a weird discipline called theoretical and applied mechanics. It was computational, like, sort of mechanics, way back in the day. But what we were describing there was the ability to take all of this, like, really nuanced data within current clinical data, and from that identify all these nuanced diagnosis types. And so I think it's bringing us much, much closer to be able to provide more precise subtypes of diagnoses that map more directly to treatments that will work for that individual or that subtype of individual. And our early experiments and some of our own research shows that this works incredibly well, and identifies conditions that people just couldn't. Like, for example, we think there's a couple of types of diabetes. There's probably hundreds of types of diabetes if you subgroup people, and they all have different prognoses, and they probably have different types of treatments which would be better for one versus another. And I think cancer care, another example, that's already been transformational there. You know, you've got groups like Tempest in town who are trying to do some of this type of work. So, you know, I think it's absolutely going to live up to the hype. The one caveat is medicine is a highly regulated, and healthcare is highly regulated. And so one of the limiting factors is going to be our tolerance for risk. And so I know that our legal departments, et cetera, at the end of the day, it goes back to physicians as legal holders of risk for a lot of these tools. And so I think that there's going to be some natural sort of legal, policy, organizational, human limitations that will hold us a little bit back. Even though the technology can do certain things, we have to sort of operate within certain bounds. And that's I think a good constraint in many ways, but one that will, I think, avoid irrational exuberance, I think would be fair to say.
Excellent. I'm glad you brought that up. I'm going to put a pin in that. We're going to wait till the representative gets here before we talk more about the regulatory landscape. But Dr. Coe, we want to stay with you a little bit. We've talked a little bit about, you know, hearing more about AI and public consciousness. It seems like you can't go anywhere anymore without hearing about AI, generative AI, the different chat bots and things like that. And I'm just curious, you know, as you start to introduce this to the patients and, you know, other people within the, you know, the provider network system, as they become more aware of this, what can be done to earn their trust on what this can be done with this technology?
Yeah. You know, a really good example of this is where it's getting out ahead of us is in mental and behavioral health. AI tools and chatbots are being widely adopted by young people, teenagers, and not often, but it has been to poor effect, you know, really poor outcomes. So I think people see that and it shows up in the news. I think that's, even though the technology is incredibly promising, I think what we can do is to provide legitimacy to it, is the science has to catch up. It has to, we do have to provide the strong evidence base that these do work compared to its current standard of care. It has to be peer reviewed, it has to be done at scale. And right now we're not catching up. But we can. And again, I think AI tools will help us get there. I think we're able to capture a much wider variety of scenarios with it, and larger sets of data that would allow us to perform the legitimate science that will, I think, build trust. As long as science is trusted, I think that's still a debate in this country, it seems right now. But I think that we do have to still adhere to scientific principles.
Definitely, and that could be a whole other event in your day, but we'll stay with AI now. Dr. Cybulski, I want to go to you just kind of on that same question, just as you kind of start to introduce more of these AI platforms and, you know, technology, just how do you make sure you have the trust of the patients and, you know, the other providers in Humboldt Park Health to, you know, to help them embrace this and kind of educate them, as it were?
Well, first I want to say, you know, great insights by my former colleagues here, and just want to, before I take that, it's low back pain. Low back pain is one of the great still mysteries of medical diagnosis. So I think AI and the things that we're working on are going to help with that. But But really, it's still it's still the ability to communicate with our colleagues and with patients, and really have a meaningful interaction. We may think that we're having a meaningful interaction because we're giving people the facts, but it's more than that, and that's where people are, and I know you're going to get to this. People in healthcare, some people are very uneasy about what AI is going to do to their positions, and what it's going to do is it's going to radically change positions of people, but it's going to give them the ability to interact and really to learn about how to communicate and connect with people and engender that trust through that, which will be essential.
Actually, Dr. Hammer, I wonder if you can weigh in on this. Just kind of how do you make sure that the patients and the providers and physicians have that trust in the AI, especially as we become more aware and conscious of AI for all its pros and some of its cons that we've seen.
Yeah, well, I want to reiterate what was said before, which is, at the end of the day, like everything in medicine, this comes down to data, right? And validation. And I think this addresses the question about regulation. At the end of the day, much of our regulation, thank goodness, is based on, did you prove that whatever claim you're making is in fact a valid claim, and you have data to support that? And that is, I think, the fuel and the bulk of the work that goes into, or a big bulk of the work that goes into whether something passes through the regulatory phase. Is you got to prove it's safe and effective, and now we've added some other things, fair and other things, which are all good. And the hard part, I think, here is going to be, as you point out, that our science is not caught up. And I think in many ways our academic system is not set up to handle the pace of change the amount of work that's being done and the pace of change that's happening. I mean, just the time it takes to do a study and then have the paper go through the review process. There's 17 new versions of like ChatGPT or whatever, and like whatever you did was now like outdated. And so we need a new paradigm. That new paradigm may actually be one that I suspect is based in AI. Maybe that's something we should talk about afterwards. But I think we need that paradigm to happen in order to realize the vision. And my vision in terms of patience and trust is my anecdotal experience with patients has been, one, they mostly think we're using AI more than we do. I think many patients are shocked to hear that all this stuff's in their medical records, and then they hear how we use those medical records, and it sounds super primitive to them. And I think they're right. Like they think, didn't your medical record tell you X, Y, and Z? No, it did not. And so I think in many ways they expect and are generally happy with the idea that the medical record will serve as a second double check on the clinician, and to the extent that we make that real, I think that's a good thing that increases trust. I think the minute they perceive the AI has forbidden them from getting certain care, prevented them from being able to talk to someone they need to talk to, prevented them from getting payment for services they felt they needed. At that moment, then that's where the trust in AI for that purpose will be lost. I think the main thing to think about here is really, at the end of the day, it's trust not just in AI, but in AI for a specific purpose. I think AI for ambient scribing, people trust it. For AI to help support clinicians not to make as many mistakes as humans can do, I think that's a good thing. AI to decide whether or not your bill is going to get paid, there may be a little more nervousness around that. At least I perceive that.
Absolutely. And Dr. Hander, I want to stay with you, and again, sorry, it's going to be a little bigger conversation, a larger conversation, but we touched on it a little bit earlier, but obviously healthcare across the country is going to be facing some challenges going forward. Obviously, it was, some of the potential cuts to the Medicaid program, social services. Obviously, there's already workforce issues happening throughout, the state. And I'm just curious, just kind of, where do you think what role AI has in helping providers, with some of these face some of these issues, not only with the less resources, but, with workforce, with access to care, kind of, where do you see AI's role in this?
Welcome.
Hey,
Sorry.
sorry.
I think there's always been a lot of change and a lot of pressure in healthcare. It seems like every year, it always looks like, how are we going to get through the next year with all the change that's happening? This feels even more so like that. At the same time, we do have AI, which does look like it may help us with a lot of these things. I mean, right at the moment that we're having workforce challenges, in comes this thing that can do a lot of things that humans, that used to be the sole purview of humans, so it looks like maybe this will help us to navigate that. That's also a little bit scary, because if that goes too far, then what happens to us, right? We don't want to be out of jobs. And so I think I'm somewhat optimistic. At the end of the day, we've long known we have a shortage of, we have a supply-demand issue. That's not new, it's just getting worse. And so I may regret saying this later. At this particular
Well, this is
second,
your personal opinion, that's right.
at this second, I am not terribly worried that AI will take over every job in the universe. What I'm more worried about is how do we serve all the patients in need? And if AI can help us do that, I think that's a great thing. Will it? I think it's not going to just happen. It happens because we actually have to go out there and make it happen. That's what I think we're all trying to do here. And I'm sure many of you are trying to do it as well. And I think it's really, at the end of the day, the future. I don't look at the future as a thing that happens. I look at the future as a thing that I and all of us need to make happen. Whatever is the future we want, we got to go invent and put that future into action. And I think that's the only way we're going to succeed.
Fantastic. We're gonna let the representative settle for another minute or two. I'll go to you on that, kind of that broader question. As we start to enter this situation, as it were, with the different changes happening, just kind of what can be AI's role? How can AI help providers navigate through this? As, limited resources, help address workforce, or even maybe access to care?
Yeah, this week, Chicago is hosting the Radiologic Societies of North America, and it has become like a hotbed for AI innovation. And if you look at the radiology field, it stands to reason it might be one that might be disrupted first. It's a lot of image-based processing, that kind of stuff. No, it's the opposite. We're projecting like a 40,000 radiologist shortage in this country in the next 10, 20 years. So if that's any indication, I think we are all very, very safe. I think that the issue that Jonathan brings up is far more important, which is that currently today, we do have this tremendous disparity in healthcare access and the providers that are out there. Illinois is an example of it. I think we have a very heavy preponderance of providers in the Chicagoland area, but the rest of the state, there's a huge shortage scattered around the state of Illinois. And so if there are tools that can locally save time for clinicians to spend more time, see more patients, that's a wonderful thing here. But then in places where there aren't physicians, how do you use AI to help scale their time? Or for example, again, mental behavioral health. It's already out there, people are using it. And is that a way for us to provide care to places that need it most? And the other thing that AI can do is to help us effectively identify where there is supply-demand gaps, so that you can provision, whether it be remotely or in a sort of scheduled basis, care to people that currently don't have it. I think the real crisis in this country today is still very much a lack of appropriate and adequate number of healthcare providers, and that's not likely to change. And I think AI can certainly help address that.
Absolutely. Representative Morgan, thank you. I'm glad you're able to get here this morning. I just kind of want to get your general thoughts on this conversation, just kind of as we talk about the advancements in AI. With your background, healthcare one, as a current lawmaker, just how do you look at this rise of AI in the healthcare sector?
Well, first, let me apologize to everybody for my tardiness, and no disrespect to my amazing panelists and also the audience. So sorry, and thank you. Most of my colleagues, there are 190 or so state legislators. If you go around the country, another 7,000 or so total. Okay, so there are a lot of people that are working on this at the state level. And I think across the board, the vast majority of them know that there is AI out there, and the vast majority of them have no idea what AI really is, or the potential utilization, or the risks, or the benefits, and the things that come with that. We know what we know, and I think there's a lot of legislators that know what's out there, don't really know what it means, let alone what we can and should do as legislators. The artificial intelligence, the evolution of it, and the way in which it's already so integrated in our society. If we're just sticking on healthcare, it is by the month, new advances, new integration into the systems. You know, I've been in healthcare for 20 years. I know my panelists have for many years as well. We know healthcare, we understand how we got to be here today in terms of the ways our healthcare provider shortage, our institutions and our silos of healthcare professionals, healthcare facilities, and all the things, payers, on and on. Artificial intelligence has so many opportunities. I just dovetail what we were just hearing. There's so many opportunities to break down some of those barriers to care and access and innovation and the care that I live in the north suburbs. The access to care in the north suburbs is 9 days to accessing care in southern Illinois. And you go to any state, you're going to find that. So artificial intelligence provides an opportunity to break down those barriers and to democratize healthcare in a way that we've probably never seen. That I think technology was really starting to get there with telemedicine, telehealth, but really artificial intelligence has so many potentials. So the question for somebody like me is, so I guess two things. Is there a role for a legislator, state in particular, to do something here? Provide guardrails, ban things, regulate them, provide more transparency, not just to the state, but to the consumer, to the patient. And then secondly, where does the state role versus the federal role come into play? I've spent a lot of time over the last, give or take 12 months, and just shy of 12 months since the new administration, thinking about what we have all come to become very comfortable with in this relationship between the state and federal government and healthcare as a partnership. And my thesis today is that those days are over. And the sooner that we come to terms with that and start to act that way, the better off our state is going to be from a healthcare metric. So artificial intelligence is no different. Today, literally as we sit here today, the federal government is debating whether their next DAA is going to involve a ban on all state regulation whatsoever on artificial intelligence. And so my bias goes back to healthcare. I think about whether or not that means we can do anything or whether we should do anything. So these are the things that are on minds of people like me.
Definitely. Yeah, and I'm glad there's a lot to unpack in that.
Sorry. I just went right in. I know I was short on time.
No, you're good. You know, and obviously, you and your colleagues have previously held a hearing on this, the rise of AI in healthcare and what potential regulations are necessary. And I'm curious, what are those conversations like at this point? Is this something that you and your colleagues are still talking about? Assuming there is no federal action, of course. What are the conversations like in Springfield about this?
It depends on who you are. The legislators reflect the diversity of society in terms of their view of government. Some believe hands off completely, let free market take care of innovation, and we'll all be better for it. And if there's some crackheads along the way, so be it. Others are strong believers in heavy regulation because of the best interest of the individual and really anti-corporate interests. So you get some of that, right? And name a topic, that's not specific to healthcare. On this issue, we're building the plane as it's in the air, and what is always true in government and legislative activities, we're always behind, right? We're always 10 steps, 20 steps behind of where we need to be because we're a slow deliberative body. So the question is, what can we do? We go back in January for the legislative session, and most of our laws for 2026 will pass in May. So what is it in May that we will be faced with that we are not even aware of today? And those are the things on our minds, and for the next steps, I know, and I think most of my colleagues are at least attuned to, that in the next 6 months, things will be different than they are today. And our lack of ability to act with that urgency means that Specifically, I focus a lot on health insurance.
Yeah.
And so health insurance payers by the day are outsourcing their claims reviews to third-party payers and almost third-party entities, so almost exclusively now AI generated and AI controlled.
Yeah.
It's a total black box. Today, the Illinois Department of Insurance has no visibility whatsoever into what those third-party entities and systems are doing and how they're doing it. And I believe that's a real risk. You're starting to talk about life and death decisions in a way that we don't have a clinician, a healthcare professional having oversight of that, let alone the state regulators knowing what's really happening. I think that is the next area I'm going to be focusing on. And when it comes to healthcare, then there's the whole bucket of everything else. Lake Forest Hospital is building a new wing, and it's a massive new facility. A lot of unmet need there for the whole greater Lake County region. And what they're doing is they're integrating television screens that are AI enabled, so they can track a fall risk and bed sores and all these things that go back to, do you need a nurse in the room 24/7? That's not practical because we don't have the workforce. So how do we do that in a way that creates better quality outcomes? I see that as a huge opportunity. That's exactly what we should be looking for, plus having more nurses and more bedside supports from healthcare professionals that are looking for work that's not $25 an hour, but can be $45 or $65 an hour.
Absolutely. Great. Dr. Hainer, I want to go to you on this kind of topic as we talk about, regulations. Just how do you see that balance for, the regulators who are looking and talking about this and making sure there's still ability for innovation in the space? What do guardrails look like? That are reasonable, but also, yourself and OSF and other providers to, continue to expand this, this work.
Yeah, I got put on to co-lead our generative AI group at OSF, and so we struggle with this question a lot. Therefore, I think about it a lot, and what I concluded was, man, am I glad I'm not a regulator. Because these are definitely competing priorities, right? I mean, everyone beats up the FDA, they don't go fast enough, and then the FDA lets some drug out that's gone through 50 gazillion different kinds of tests, and then they find out later that, in some percentage of people something bad happens, and now they get beaten up. And it does feel like a no-win situation here, and I don't actually have a pat answer. I would like to say, hey, let's go fast, but let's also be safe. Okay, fine. The hard part is, how do you actually do that? And I don't know. My magical answer in the back of my head is AI will solve this problem, but I'm not 100% sure how we put that together. I have some thoughts about that, and I do think that if the AI can help us develop the evidence to prove that the AI is working, and can do so in a way that we can trust, that may help us a lot. If the AI can help us evaluate the evidence more fairly and effectively, I think that may help us a lot. And I think one of the places where regulators can help us is if we are further encouraged to make data assets available, where if these things are driven by big data, if I want to evaluate, will this work on, if you tell me I have to put together a multi-center trial, do you have any idea how much work and time and effort and money that's going to take? Right, that's years of work and pain and agony. If there was just a centralized place, and we do have some of these, all of us and some other things that have been supported by the government and others. We just need, I think, more of that stuff. And at some point, we may have to make some decisions about our thoughts on sharing data and our thoughts on the benefits of data and where do we place the priorities, and some of those things may evolve over time. That's my best, probably inadequate answer.
Yeah, Representative Morgan, you may not recall, I actually came down to Springfield to testify about AI and insurance. Yeah, so I do think that artificial intelligence is going to be ubiquitous. And so from a regulatory framework, it's going to be really, really difficult to make general broad. So I do think an approach that focuses on specific applications of artificial intelligence makes a lot more sense. So for example, focusing on insurance issues and pre-authorization, that's something that is in the state's purview. makes total sense for us to regulate how a methodology like AI might be applied responsibly in that space. There are examples, I think, of federal and state sort of like overlapping regulations, like privacy, for example. So in the privacy space, there are the HIPAA regulations in healthcare. They've been, federal across the board. But state by state, there are also state privacy regulations. Like Illinois actually has been, I think, one of the leaders. California is way out there, but Illinois is right behind. Things like Personal Information Protection Act, these kind of things are in place. So I think there is precedent set for states to come in and have clear, on the ground, reality, driven policy, especially around specific domains. But I think broad, like sweeping, it's changing too fast. It's too ubiquitous. I think it's gonna be very, very difficult for us to come up with something that's going to be relevant today and 10 years from now, unlike privacy regulations.
Definitely. And Dr. Crowe, I will say again, and Dr. Cybulski, I do want to get your thoughts on this as well. But Dr. Crowe, as we kind of look at this right now, obviously, just curious, as a provider, does there need to be larger, just federal response to this sort of guidance, or can a group like Northwestern work with a state-by-state regulatory response? Or what do you see as?
Well, I'm going to give on the federal side for now, because I think there were regulations that were or guidelines that were put in place, like NIST was an organization that was sort of had a number of sort of like, it was a convener of thoughts at the federal agencies about AI. And with the new administration, a lot of that went away. But I think if we don't take advantage of expertise with our local organizations here at the state level, I think that'd be a mistake. And so I think where we can help, I think many of the institutions stand ready to provide examples, stories, science. But I think so. Yes, we would start state and then federal. That's a little trickier. I mean, there were a number of us, I think, who served on certain federal advisory panels, et cetera. But I think many of those are sort of good legacies.
Definitely. Dr. Cybulski, I do want to get your thoughts on this, just kind of as these conversations persist, just where do you see that balance is, making sure there's some guardrails in place, but also making sure there's space for innovation?
Talk about the regulation of use of AI is much more complex actually than developing the things that we've been developing to implement AI clinically. So hats off to legislatures who are interested and committed to this, because we're trying to solve problems at the patient level, and that's always been our focus as physicians, and we need the collaboration. It's extremely valuable. Next week, economics is kind of my hobby, so I'm going to University of Chicago symposium next week on regulation, and they are, in the past at least, with their Nobel Prize winners in economics, George Stigler, they've been hands-off in regulation. I don't think that's possible with what we're discussing today, so it'll be interesting to see what I can learn about that.
Definitely. And Representative Morgan, I do kind of want to get if you can dive a little more into kind of as a regulator yourself, just kind of how you try to strike that balance.
The challenge, of course, the challenge, you all can hear me. We're fine.
Yep.
There you go. Sorry. No need to yell, we're all in the small room. The challenge again is we're touching on the right topics and the right themes, which is we can pass a law and it can be obsolete in a month. And so we're really sensitive to that. I'm really sensitive to that. We're never going to get it perfect. That's just not the nature of what we do. But there's a lot of things we can do that would negatively impact the evolution. And when we passed, we talked about mental health, we passed a bill, I passed a bill this spring that banned AI therapy, AI therapist bots. So apps that are holding themselves out and itself out as a licensed therapist. It's that last piece that makes it illegal against the law, which is that you're holding yourself out as a healthcare professional, but you're really not. That's not even a new concept for healthcare. We've been doing that for decades. You can't set up a bagel shop and then the bagel shop say, I make great bagels and I'm a doctor. You can't do that. We regulate that, we enforce it. We have discipline for that, fines, penalties. This is not new. That's a decades-old concept in healthcare. Every state has that. So if you stay within that principle, that makes sense. But then you get to the hard question, which we didn't answer in this legislation. And you're seeing this in the news stories every week, if not every month. Somebody was interested in committing self-harm, suicidal ideation, and they go to ChatGPT or OpenAI or whatever. They're asking questions about how to commit suicide. What is the generative AI supposed to do? And can we and should we, it's the best answer, best question, should we create state regulation around that? I have yet to see what role we are supposed to be playing there, other than encouraging these systems that are dealing with this literally on a daily basis to think about these things, make decisions, be transparent about that, again, not just to the state or the federal government, but to the user. Character AI. I have a sibling, I have two siblings, I have siblings with special needs and a sister-in-law with special needs. And Character AI has been a resource tool for one of them to just be a partner, a friend. And that's a completely unregulated app, as opposed to, she lives in Misericordia. Misericordia has dozens and hundreds of trained staff who know what to do and how to do it professionally and safely. And so if Character AI is going to take over the daily care and support services for my sister with special needs, how is that going to play out? And does government have a regulation role there? So these are the things I'm thinking about, and I really do think my legislative kind of North Stars, there are times where the government and regulators should not be involved. We have to be equally as comfortable recognizing that and really creating a culture around that, because otherwise we're going to get ourselves in areas where we just cannot regulate, we don't know what we're doing, we're going to create unintended consequences, and this is where we're at.
Right. And I just want to say, if anyone wants to start a bagel shop that also has a clinic in it, I mean, that is $1 million idea.
You're surprised. I love bagels and.
We have about 7 minutes left, so I do want to open this up to any questions from the audience if we have any. If you have one, please raise your hand. I'll call on you as I see you, and if you can, just please let us know who you're directing your question to. I saw you. I'll go over there. Go ahead.
Susan Swartz, Executive Director for the American Nurses Association of Illinois. We've had a lot of conversations here around medicine, which is physician-driven. One of the problems that we have in nursing is not always at the table when decisions are made about the use of these types of services, and then the impact that it has to us. As let's talk about ambient AI, where you're recording things and it becomes part of the record. Well, if that becomes part of the record, it was something that I performed, but I didn't get a chance to review it before it became a permanent part of the chart. What is the consequence to my profession, to my license? So those are some of the things that nursing is having a lot of conversation about. We want to be successful. You all know this. Representative Morgan has heard me say this. You need to get the nurses at the table and get them comfortable with it, because they are not comfortable with AI. There is the generation we have this big gap of a lot of older nurses, and then this younger group coming in that will be comfortable. But we stick around in the profession probably longer sometimes we probably should, and those are going to be the individuals that you're going to have to convince to use this. So how do we do that safely, and then how do we protect the clinician, because that is a very big piece that we're worried about.
Thank you, Susan. Anyone want to take that?
Hi, Susan. This is something I'm hearing from hospital CEOs. I'm hearing it from different licenses. It's one of the reasons why our bill banning AI therapy was critically involved and included the National Association of Social Workers, because that conversation had to include the professional. And when we were looking at how to draft the bill, one of the things we tackle is how a therapist can use AI in their practice. And what we really fell back on was the existing practice. When you're taking a note and you have your software program that is transcribing that note, you as a professional are still responsible for double checking that note transcription, right? So if we use that as the basis, we want AI to be available. There are more and more therapists, more and more nurses, more and more doctors that are using AI. And finding new, better uses for it. So we want that to continue, and there still has to be accountability. But I think that's a really important note, that if we start talking about the totality of healthcare, we have to involve the healthcare professionals who are implementing that. It is a struggle, it has a cost, time cost, literal cost of dollars, technology cost, distraction cost of what they're doing and responsibilities. So these are happening in real time, and people like Susan need to be in the room.
The guardrail though, the guardrail that I'm concerned about is nurses are employees of large systems, and if those systems are not good actors, what guardrails are we building for them to be held accountable for having their building policies that don't follow those?
Yeah, John.
Some of the problems that you mentioned were present before AI, and
Yes.
some of those things that AI has been proposed as things that can help. Nobody reads each other's notes. There's too many of them, and so the ability to have AI go through and summarize the totality of notes for each of the individual providers and clinicians may be a benefit that actually helps. I remember, we in the emergency department where I worked back a million years ago when we were on paper, it wasn't like in other parts of the hospital. We're literally, the emergency physician is there all the time with the nurse all the time. We're not like away somewhere, it's a team like, I don't know that there's, maybe except in the operating room, there's no other place where you have that kind of teamwork. And I still looked down once, and I came by and I see on the note, the nurse had written, who I love by the way, patient complaining of chest pain, MD aware, and I'm like, wait, no, I wasn't, and I complain. So those kinds of miscommunications happen both ways, and always have, and hopefully AI may help us with this. One thing that I have generally lived my life by as an informatics person is something called Gruden's Law. By the way, Jonathan Gruden, so he got the first name, which says something along the lines of, if the people using the technology are not the beneficiaries of the technology, they'll subvert the technology. And so if the technology is not benefiting the nurses, the doctors, the people that are actually using it, they will find ways to subvert it. And so I think that's a nice feedback mechanism to make sure that the technologies, I should say make sure, but one way to help encourage the technologies to do the right thing is that they have to be perceived as being beneficial to the people that are using them. Otherwise, they very often don't get adopted. And so hopefully that helps a little bit. On the other hand, whatever we could do on the regulation side to help protect us, I think that's all a great thing.
We do have one more question. We're almost out of time, so I want to make sure we get one more question.
Good morning, David Porter from the Illinois State Medical Society. Dr. Koch
Yes,
spoke at our annual meeting a year and a half ago, was very well received, and we thank him for that. My question is for the physicians on the panel here. What are your thoughts on so-called transparency legislation that would require physicians and other healthcare providers to tell their patients they've used AI either in diagnosis or treatment plans?
I'm a fan. I think that's good practice. If you look at Chris Longhurst at UCSD, I think was a good example of this. Before he's now taken a different CEO role at UCSD Health, they made it standard of care. So if you got a note back from the provider that was generated by AI, it said at the bottom. If there was a note, and this is how it has always been actually in a lot of healthcare places, we have a little phrase that would show up that says, even before AI, I acting as scribe did this on behalf of some person. There's precedent for this, and I think if you author something, someone needs to know that. I think that's pretty clear, and it's again, there's clear precedent for this, and I think this is almost a non-issue.
Perfect. Anyone else want to weigh in?
Yeah, I agree, and I think we need to do more. I have put implants in people's spines for decades and have not had any consulting arrangements. I maybe received a dozen golf balls 20 years ago from a striker. But my point point being is that patients are getting implants, and the surgeon has a consulting relationship that is really just on paper, and so I think, yeah, I'm all for transparency in every aspect of medical care.
Maybe
Close us out here, Dr. Hayward.
just because it's my nature to be contrarian, I'm not against transparency, let me just be, okay? I'm all for it. However, it also depends on how you define AI. And AI gets redefined every single time there's a new AI that comes out. All the other stuff that came before it, that wasn't AI. This new stuff is AI. And so it's just this constantly evolving thing. If you look at some definitions of AI, in the way we thought about AI before, basically anything with a computer chip in it, it's basically AI, you know? And so what, if you used a calculator, do you have to say that? On the pulse oximeter, how do you think that waveform got on there? And the number that got translated from the electrical signals, like that was a computer, that was figured, you have to document that that was, AI did that. So I think those kinds of things, they're like, we're all for them. It's like saying, the things should be fair. Yes, and how do we make that actionable? Without being unreasonable, you know, at the end of the day, otherwise you just have to give somebody a blanket statement, AI will be used everywhere, you know,
Right.
the end. And then is that even helpful to anybody?
Right.
So I think it's a really interesting question. I'm 100% for transparency, and I think the how on that is, looks to me like a big challenge.
Wonderful. We're at 10:02, so I'm going to wrap up here. I want to thank all our panelists for joining us today. I want to thank you all for coming out braving the weather this morning. This is our last event of the year, so I want to wish you all a great rest of your day, week, and the rest of your holiday season. Thank you so much for all the support, and we'll see you all next year.
Thank you.